Hi everybody, welcome. My name is Ruth Ochoa and today we're going to go over myofascial self-treatment for the fingers. So if you're someone that is dealing with some arthritis symptoms in your fingers or just finger pain, a lot of us are on our cell phones a little too much these days and that's a lot of work for our fingers, or if you're typing a lot, this is a great exercise for you. So it's gentle and it's easy. Obviously we have 10 fingers, so if you have time to treat them all, that's awesome. If you have particular fingers or joints that are bothering you the most, it's totally fine to focus on treating those. Do try to find the time to treat the other the other fingers whenever you can, but just begin with the ones that are bothering you the most. So if you can be seated, that's great. If you're standing, it'll still be perfectly effective. I'll be using my index finger for the video today. So if you're having a particular joint within the finger that's bothering you, you can place your hand directly above or below that joint. If the whole finger is feeling kind of sore, or this one tends to be a little more achy, you can just hold the entire finger right above the knuckle and just wrap your other hand around it. And then just gently grasp that finger. If you are sitting at a table, you can let your elbows rest on the table as long as that's comfortable for you, and you want to make sure you're maintaining good posture. So grasp that finger, and then we're just going to start off by rotating it clockwise and counterclockwise. So rotate it one way and make a mental note of how that feels, and then rotate it the other way. See how that feels. So we are assessing the range of motion on the finger. So now go ahead and go both directions again, and just decide which direction it feels like your finger rotates the easiest. So with the least pain, maybe it goes a lot further that direction. So just go ahead and make that assessment. If you can't really tell, just go with your gut instinct. I'm sure it'll be fine. Okay, and so once you've decided that, go ahead and grasp that finger and rotate, grasp the finger, compress in gently. So compress the finger in towards your wrist very gently. And then go ahead and rotate in whichever the direction was easiest. I'm going to start our little timer here. So if you have 3 minutes to spend on each finger, that's excellent. I would recommend it, especially if you're trying to ward off any kind of joint issue. That if you can be thorough, it's going to be a lot more successful and effective. So we're just compressing the whole finger gently in towards the wrist. So the opposite of pulling the finger, that's what we're doing. And then we're maintaining that rotation of the entire finger in the direction of ease. If you haven't already, go ahead and close your eyes. Focus on what you're feeling. If your left hand, or the hand that is grabbing the finger, is feeling tired, you're gripping too hard. You don't need to grip that hard. Gentle compression in, gentle rotation in the direction of ease of the whole finger. And breathing. So notice what you're feeling. One thing I should note, if you're having a hard time holding onto your finger, you might want to go wash your hands. If you put lotion on your hands today, this is going to be a lot more difficult. So if you're sitting down to do some really thorough, good treatment of the fingers, it's going to really help out to wash and dry the hands first. Very good. So just keep compressing in gently, gently, and rotating gently, and breathing. So notice what you're feeling throughout your whole hand. You might just be feeling some sensation in the joints of that finger. It might feel kind of like a stretch, or a slight ache is okay. There shouldn't be any strong pain. And notice how your whole hand is starting to stretch with that finger, and that's what we want. The finger doesn't move independently. All the tissue in the hand and the arm are helping. So if you're someone suffering with carpal tunnel, this would be a great one to add to your self-treatment routine as well. So we're continuing to just gently compress the finger in, and then continuing to rotate in the direction of ease. And you'll notice from time to time that you feel like, oh, I can push my finger in a little more. Go ahead and gently compress in a little more. And you'll also notice from time to time that you feel like, oh, I can twist my finger a little bit further. I can rotate it a little bit more. So that means that the tissue has released. You can pick up the slack and take it a little further. Often after we've been holding this for a minute or so, you'll feel your whole hand start to relax. And so just let your hand that you're treating soften, whichever one you're working on right now. Let the whole hand soften. Maintain that grip on that finger. Maintain that rotation. And see if your hand wants to get involved in the stretch at all. Keep breathing. You're doing great. This is going to feel amazing when we're done. So if you're feeling strong pain in your finger, you are compressing too hard or twisting too hard. There shouldn't be any pain, so just back off a little bit if you are. Doing good. So just keep compressing the finger in, gently, and rotating. When you first start doing this, if 3 minutes is just too long, even 1 minute would be awesome. But the goal is that ideally we're holding these positions for about 3 minutes to allow for a complete and deep release of the fascial tissue. So that's why you will hear me say that over and over again, because it's necessary, and we want to make sure we're getting the most out of our self-treatment, that we're being thorough, and of course not wasting our time. So you can see my elbows started rising up while I was doing this. That's okay if it feels okay. Just make sure that you're conscious of your entire body. For me, it felt like that was going to help me get a better stretch into my finger. So as long as you're soft and as long as you're able to stay fluid, it's totally okay to change your hand position. Okay, so there's our timer. So gently, allow the finger to rotate back first to neutral. Look how far you went. And then go ahead and release that grip. Wipe your hands, dry them off if necessary, and if they're full of lotion, go wash them. And so now we're going to go in the opposite direction. I'm going to lower my chair down a little. So whichever direction we were just rotating, we're going to be treating the same finger, but now we're going to go in the opposite direction and we're going to elongate. So now we're going to pull gently on the finger, traction out. So don't be going the same direction, you just might go the opposite way. So go ahead and grab that same finger you were treating and position your hand the same way. Rotate the finger in the opposite direction. And allow the hand that's gripping the finger to kind of sink in. So don't just rotate all the way to the end right away and then pull. Be gentle. Gentle is better. And then after that rotation feels like it's creating a nice little stretch in the finger, then we're just going to gently elongate and traction the finger away from the wrist. So before we were compressing, now we're elongating. Should feel really good. And if your hand that is holding the finger is hurting, shaking, anything like that, you're working too hard. So you don't need to grip that hard. You can close your eyes again and breathe. So feel some of those more subtle sensations that are happening. Sometimes I feel like my joints are just opening up as I do this, and it feels so good. Our hands work so hard for us all day. We should definitely be giving them some love. So just continuing to gently rotate that finger in the opposite direction of the first way we went. Rotating gently. And then gently pulling, tractioning the finger out gently. And allow the whole hand to soften. The hand that you're treating. And just allow your body to move whichever way feels good. Sometimes as we soften our body, we'll notice that we really feel the urge to move. That movement is very therapeutic. We call that unwinding in myofascial release. And we can always trust that movement. It will never injure us, and it's often an important part of allowing the fascia to release and allowing ourselves to heal. You can definitely trust what you're feeling. And this should feel good. There shouldn't be any pain. Continuing to pick up the slack whenever you feel like you can rotate a little further, allow the finger to rotate. And whenever you feel like you can elongate and pull a little further, allow that to happen too. Keep breathing. Remember to keep whichever hand is working, keep it not working too hard. Good. Keep rotating, keep breathing. Okay, so now we're going to rotate that finger back to neutral. Good. And then slowly release the pressure of the other hand. Go ahead and look down at your fingers. We probably should have done this beforehand too, but do it next time. It's always fun to see the increase in blood flow in the finger that you're treating. Gets nice and red. So that's awesome. Move it around a little, see how it feels. So whenever you have time to move on to the other fingers, that's totally fine. It would be much more beneficial to do some fingers than none. So don't let that stop you from self-treating. And like I said, if you have particular joints in the hands that are a little more of an issue, it's totally fine to focus on those too. Just remember that often the source of our pain is not exactly where we're feeling it, so the surrounding tissue will benefit from treatment as well. You did such an awesome job today. Thank you so much for joining me. If you haven't already, please take a moment to subscribe to my channel. I would really appreciate it. I hope you have a wonderful day, and I'll see you soon. Bye-bye.